So what is a ketogenic diet? This is the one I'll fly through. You all know this. Diet that's high in fat, low in carbohydrate, moderate in protein. It was developed in the 1920s specifically by a physician for the treatment of epilepsy. I'm going to assume you all know about ketones, beta-hydroxybutyrate, acetoacetate, and acetone. The biggest thing, I'll point your attention to the bottom bullet. Some people think ketogenic diet, you have to lose weight. Absolutely not. This diet was developed specifically for children with epilepsy, children who are growing. This diet absolutely can result in normal, healthy tissue growth, and that means weight gain. And so you can absolutely gain weight on a ketogenic diet. And so some people, when they choose to do the ketogenic diet for weight loss, and they're in ketosis, their ketones are high, they can absolutely gain weight on this diet. So that brings me to the next point. There are different variations of this diet with different physiological effects. And we do not have evidence whatsoever that these are all interchangeable. They might be. And depending on the person, they could be. But I'll walk you through some of these variations of the ketogenic diet. So the classic ketogenic diet, developed in the 1920s, is usually referred to as a 4-to-1 or a 3-to-1 ratio diet. And what does that mean? It means 4 grams of fat for every 1 gram of everything else. Fat has more calories than protein and carbohydrate. And so a 4-to-1 ratio or a 3-to-1 ratio diet basically means that 80 to 90+% of your calories are coming from fat. There's fasting and intermittent fasting because this diet mimics the fasting state. And so you can certainly intersperse fasting and intermittent fasting to get a therapeutic effect. There's the MCT ketogenic diet, adding medium chain triglycerides, which are more easily converted into ketones, can result in higher levels of ketosis with a lower ratio. So you might be able to go to a 4-to-1 to a 3-to-1 ratio diet if you add MCT oil. There's the Atkins diet and the LCHF diet, which most of you are familiar with, usually used for weight loss or diabetes. There's the modified Atkins diet, which is actually an evidence-based treatment for epilepsy. The modification is to add more fat. So you do the Atkins diet, think about the traditional Atkins diet, and this is the diet where you are, in fact, going to add fat every opportunity you have, add butter, add olive oil, add fat bombs. You're constantly adding fat. In general, the modified Atkins diet results in about a 2-to-1 ratio diet for most people, just implementing it in a kind of non-rigorous way. There's the ketogenic diet, calorie-restricted diet. So we've heard about the ketogenic diet for weight loss or for cancer treatment. And Dr. Seyfried published one case report in a human of somebody's cancer going into remission. When she stopped the diet, the cancer came back and she passed away. But I want to just be clear. The diet she was on was a 4-to-1 ratio ketogenic diet. I'm going to show you what that looks like. And she was calorie restricted to 600 calories a day. That is not the keto that most of you are doing. There are ketone supplements, and then there are websites and books and self-proclaimed experts who say, keto, I know about keto, I'll cure your cancer. Keto, I know about keto, I'll cure your schizophrenia. Please be skeptical of those claims. So a lot of people in the keto community don't really know this literature and don't know these concepts. So this is taken from the Charlie Foundation, and it is a great pictorial. What you see before you are 4 different meals, and they all contain the same ingredients, and they are the same number of calories, 400 calories per meal. I'll call your attention to the green plate. So the green plate, all of the meals have chicken breast, broccoli, mayonnaise, and olive oil. And the green plate is what most people would think of as a standard kind of low carb, maybe even keto diet. So you've got a decent serving of chicken breast, a decent serving of broccoli, and you've got a ramekin of mayonnaise that needs to be consumed, and then you've got a splash of olive oil somewhere on that plate. If you look up at the red plate, again, same number of calories, same ingredients, you get a tiny portion of chicken breast, a very paltry portion of broccoli. If you're going to eat broccoli, most people eat more than that. You've still got your ramekin of mayonnaise, and then you've got a syringe of olive oil. And all of the olive oil and the mayonnaise need to be consumed. The syringe of olive oil is great because it represents that this is not a weight loss diet. This is a medical prescription diet. It should be prescribed by a physician or clinician, and it should be monitored for safety. And you're doing this as a treatment for a serious medical disorder. This is not a weight loss diet. So let me tell you the story about the ketogenic diet and epilepsy. So it turns out that this all started with this observation that fasting can stop seizures. So this has been known since the time of Hippocrates, that if somebody was seizing in the old days, the one most effective intervention was to have them go without food. Starve them, fast them, do a therapeutic fast. For a long time, as Western medicine evolved, for a long time this was just thought to be religious folklore, because religious attribution was always the reason why the seizures stopped. God likes fasting. We are going to make a sacrifice. This person is going to fast, and the seizures will stop. It might have been even interpreted that the seizures represented demon possession. This person is possessed by a demon, and the way to get rid of it is to make a sacrifice to God and fast him, and his seizures will stop. So Western medicine thought this was just a bunch of bunk. That's crazy. God doesn't heal when you pray to him. So that's not rigorous at all. And in 1921, Dr. Galen reported the use of actually using intermittent fasting to treat a child with epilepsy and said, actually, no, this actually works. It's actually more than just religious folklore. That same year, it was the ingenious Dr. Russell Wilder who solved a conundrum. You can only fast people for so long. And then guess what? They'd starve to death and die. And usually, when you have the person start eating a diet again, the seizures come right back. So it's a great short-term intervention, but not a very good long-term treatment plan. So Dr. Russell Wilder created the ketogenic diet specifically to mimic the fasting state. He thought if we just give them a lot of fat, maybe the body will think somehow that it's taking those fat stores from your own body and that it's really mimicking the fasting state, and maybe we'll get the same therapeutic effect. And in fact, he was correct. Early results were pretty impressive. 50% of patients were seizure-free and another 35% were markedly improved. You notice this is not 100%. It does not work for 100% of people. It fell out of favor by 1950 with the advent of anti-seizure medications because there is no question this diet is really difficult to do compared to popping a pill every day. But it was rediscovered in the 1970s at Johns Hopkins because lo and behold, 30% of our current treatments, this is even to this day, 30% of our treatments don't work for people with epilepsy. People can seize despite numerous medication trials, despite brain surgery, despite electrode implants and other things. They can still continue to seize, even with the best treatments we have to offer. And the resurgence of the ketogenic diet and its use in epilepsy really should be attributed to Jim Abrams and the Charlie Foundation. I can tell you that story in the Q&A if you want to hear it. But due to him and his efforts and his advocacy, we now have over 500 ketogenic diet centers around the world. There was a Cochrane review, which for those of you who don't know, is kind of the gold standard of a meta-analysis in the medical field. Cochrane review included 7 randomized controlled trials in over 400 children. And at 3 months, seizure freedom rates were as high as 55%. Another 30% had a 50% or greater improvement in seizures. Again, doesn't reach 100%. But I want to point out, these are treatment-resistant epilepsy patients. They've already tried numerous medications and or brain surgery, and it hasn't worked. The modified Atkins diet was not found to be as effective as a 4-to-1 ratio diet. So this is where the different diets may play a different role. And in Freeman et al., if you look at all comers, at 1 year of all of these pediatric epilepsy patients who are coming to a clinic, 55% of them remained on the diet after 1 year because it was clearly doing something beneficial. 45% discontinued it either because they couldn't do it or it didn't work.